Hello everyone, welcome back to my channel. So you are watching Sandhya OBG Study Point. So in today's video, we are going to focus on hyperemesis gravidarum. Okay, so this is the condition which is happening during pregnancy. Okay, so first of all, moving to the definition. Actually, what's the definition of hyperemesis gravidarum? So for the definition, we can say it is a severe type of vomiting of pregnancy which has a deleterious effect on the health of the mother and or incapacitates her in day-to-day activities. Okay, so this is the definition of hyperemesis gravidarum. Other than this, also you can write about this. Hyperemesis gravidarum is extreme persistent nausea and vomiting during pregnancy. It can lead to dehydration, weight loss, and electrolyte imbalances. Morning sickness is mild nausea and vomiting that occurs in early pregnancy. Okay, so now moving to the etiological factors. So the etiology is going to be, it is mostly limited to the first trimester. It's more common in first pregnancy with a tendency of recur again in subsequent pregnancies. Means some of the pregnancy previously which has not been successful. Those cases are risk factors, or we can say like the etiological factors of hyperemesis gravidarum. Next is younger age. Younger age also a etiological factor. Low body mass. History of motion sickness or migraine. Family history, hydatidform mole, multiple pregnancy, and unplanned pregnancies. So these are all the etiological factors of hyperemesis gravidarum. Now, other than this, most women have some nausea or vomiting, or we can say like morning sickness, particularly during the first trimester. The exact cause of nausea and vomiting during pregnancy is not known. However, it is believed to be caused by a rapidly rising blood level of a hormone called human chorionic gonadotropin, or also we can say HCG, the hormone which is secreted by the placenta during pregnancy. HCG is released by the placenta, as I just told you. Mild morning sickness is common. Hyperemesis gravidarum is less common and more severe. Now moving to the symptoms. What are the symptoms of hyperemesis gravidarum? If a mother is suffering with this condition, then what are the symptoms she may show? So for the symptoms of hyperemesis gravidarum are much more severe. They may include like severe persistent nausea and vomiting during pregnancy, salivating a lot more than normal, weight loss, signs of dehydration such as dark urine, dry skin, weakness, lightedness or fainting, constipation, inability to take in adequate amounts of fluid or nutrition. And now moving to the diagnostic evaluation, what are the diagnostic evaluations we can do to assess this condition, hyperemesis gravidarum? So on the basis of the history collection, of course, we can identify that this condition is happening just because of what thing, okay? And next is physical examination, then vital signs monitoring, and other than this, the following laboratory test will be done to check for signs of dehydration, like complete blood count, electrolytes and weight loss, urine analysis to check the quantity whether it's small or large. If we can go with this. Next is dark color of urine, high specific gravity with acid reaction, presence of acetone, occasional presence of protein and rarely bile pigments, and diminished of even absence of chloride. Biochemical and circulatory changes. The changes are mentioned previously. Routine and periodic estimation of the serum electrolytes like sodium, potassium, and chloride is helpful in the management of the case. Serum TSH, T3, and T4. Women suffer from transient phase of thyroid dysfunction, clinical or subclinical. Next is ophthalmoscopic examination is required if the patient is seriously ill. Retinal hemorrhage and detachment of the retina are the most unfavorable signs. Then ECG. Where there is an abnormal serum potassium level, then ECG is required. Other than that, ultrasound will be done to confirm twins or multiple pregnancies. Ultrasound also checks further for a hydiatidform mole, because in the hydiatidform mole pregnancy there is a chance of hyperemesis gravidarum. That's why we have to check whether this pregnancy is normal or suffering with the condition which is hydiatidform mole pregnancy. Okay, so now moving to the treatment portion, how we can treat this condition, how we can treat hyperemesis gravidarum. The principles in the management are maintenance of hydration, to control vomiting, to correct the fluids and electrolytes imbalance, correct metabolic disturbances, acidosis or alkalosis, to prevent the serious complications of severe vomiting. Now, how we can take care of a pregnancy? Hospitalization. Whenever a patient is diagnosed as a case of hyperemesis gravidarum, she is admitted, surprisingly, with the same diet and drugs used at home. The patient improves rapidly. Fluids. Oral feeding is withheld for at least 24 hours after the cessation of vomiting. During this period, fluid is given through an intravenous drip method. The amount of fluid to be infused in 24 hours is calculated as follows. The total amount of fluid approximates 3 liters, of which half is 5% dextrose and half is Ringer's solution. Extra amount of crystalloids equal to the amount of vomitus and urine in 24 hours is to be added. This regime, rehydration, ketoacidosis, water and electrolytes imbalance are likely to be rectified. Serum electrolyte should be estimated and corrected if there is any abnormality. Internal nutrition through a nasogastric tube may be also given. Now, on the basis of the drugs, what kind of treatment we can give to the patient? In the drugs, antiemetic drugs, triflupromazine, Squil 10 mg VD or TDS IM, trifluprozine, also we can say espazine 1 mg BD IM, vitamin V6, doxylamine, promethazine or we can say phenergan 25 mg. Hydrocortisone 100 mg IV in the drip is given in a case with hypotension or intractable vomiting. Oral method prednisolone is also be used in severe cases. Nutritional supplementation: vitamin V1 100 mg daily, vitamin V6, vitamin C and vitamin V12 are given. Nursing care: symptomatic but firm handling of the patient is essential. Social and psychological support should be extended. Preventions: avoid triggers. The pregnant woman may notice that certain things can trigger nausea and vomiting. These may include certain noises and sounds, even the radio or TV, bright or blinking lights, toothpaste, smells such as perfume and scented bathing and grooming products, pressure on your stomach, wear loose fitting clothes, riding a car, taking showers. So now moving to the possible complications of hyperemesis gravidarum. Maternal complications may occur, like the majority of the clinical manifestations are due to the effects of dehydration and starvation with resultant ketoacidosis. Leaving aside those symptoms, the following complications may occur, which are fortunately rare nowadays. neurologic complications. Wernicke's encephalopathy, very due to thiamine deficiency. Pontine myelinolysis, peripheral neuritis, Korsakoff psychosis, stress ulcer in stomach, esophageal tear or Mallory-Weiss syndrome, jaundice, hepatic failure, convulsions and coma, hypoprothrombinemia due to vitamin K deficiency and renal failure. And in fetus, what are the possible complications? So now for fetus, the complications may occur like fetus usually remains unaffected once the problem is resolved. Fetal risk may be due to low birth weight. So on the basis of this condition, we can say like the baby or the fetus may be suffering with IUGR condition, that is intrauterine growth retardation. So these are all the complications of fetus. So these are all the possible complications of hyperemesis gravidarum. So like this, we have completed our today's topic, that is hyperemesis gravidarum. So I hope you found this video really helpful to you all to understand what this hyperemesis gravidarum topic. So I'll see you in the next one. And also if you want to suggest me a topic you want me to teach you all, so you can suggest me there in a comment section below. And I will see you in the next one. Till then, goodbye and take care.